Are you in pain? Is your body not at ease? Lifting that heavy box has put you in bed, sick. Today we focus on pain management. This is Good Morning Sri Lanka. I'm your host, Jason.
And I'm Amaya. And today we'll be talking a little bit about how you can alleviate the daily aches and pains in your lives, as well as how you can manage more serious pains. But it's a Monday morning, it's the start of another great week, and we're so happy to be here with you today. And we have someone here with us, a very special person, who's a leading specialist in the field of pain medicine. So without further ado, let me welcome to the studio Dr. Namal Senasinghe.
Hey,
and
there he is.
Good morning, Doctor.
Good morning to you.
Hi,
Good morning, Doctor.
Good morning.
Please have
Doctor,
a seat.
this is such a
Thank you.
great attire you have on. Is
Yes.
this usually how you dress to work?
I think so, right. No, yeah, this is the attire for my work, especially for the recent guidelines for infection control. The doctors are prohibited from wearing ties because the ties touch the bed linen and things, and there is a risk of transferring infections to the patients. So there is a no tie policy. Therefore, I think some doctors took up the bow tie, and I'm one of them.
Everyone, all the doctors where you work look like James Bond.
No, not. Probably about 3-4 doctors wear the bow tie. Others come without a tie or a bow. So it's our choice and our option. We have to look different to the nurses. So
That's important as well,
Yeah, of
isn't
course,
it?
yeah.
All right, now, so where are you from? You're working at Kent, the Canterbury Hospital.
Yeah.
That's in the UK.
Yeah.
And you came down to Sri Lanka. You're about to be working here, I'm guessing now.
Yeah, it's a new arrangement I had with my employer, the NHS, which is the state sector in UK. They were nice enough to release me every 6 weeks for 2 weeks to come to Sri Lanka, because they know that I love Sri Lanka so much. They realize that they might lose me. I don't know how much they want me, but then they were nice enough to release me for 2 weeks every 6 weeks. So it will be on a rolling 6 weeks in UK, 2 weeks in Sri Lanka. So my 6 weeks starts from, my first 2 weeks in Sri Lanka starts from Monday, and then back to UK 6 weeks, and then back here for 2 weeks. And so I have to come back because I'll be off for 2 weeks.
All right, so why do you want to come back to Sri Lanka? I know it's your hometown. I know it's your home country.
Yeah.
But why back to Sri Lanka when you're living in a great life in the UK?
I won't. Well, life is great all over. Actually, I mean, I won't say it's greater than UK. Sorry, in Sri Lanka, but Sri Lanka is my home. I never want to leave Sri Lanka, but for reasons at that time, we left, and so we stayed there. But my mind is always here, and I think I love Sri Lanka. And then I think there is a compromise we reached between me and my wife, because my wife prefers to stay in the UK, and I want to come back. So then she said, okay, let's do this, and I'm happy that the hospital was helpful as well.
All right.
So I think I'm lucky in that way.
So you've had a career spanning over 11 years in pain medicine.
Yeah, as
is
a
it?
consultant, 11 years.
So why pain medicine, Doctor? Pain management. What got you interested in that field?
Actually, I like to be with patients, and I trained as an anesthesiologist, and I qualified as a consulting anesthetist. But during my training, I liked pain medicine because you have one-to-one contact with the patients. Not that you don't have an anesthesia, but the patients go to sleep. So there's no challenge, and I felt it's better to, it's another option, closest option to being a physician. In anesthesia is becoming a pain medicine consultant. So I think that shifted me towards pain medicine, and you get a thrill because helping to alleviate pain is it's quite rewarding.
And challenging as well, I'm sure.
Yeah, of course it's challenging. I mean, in UK especially, if the loss to the economy is huge. There's 50 million days lost in work. When you multiply the number of the patients taking time off from work with the number of days taken, it comes to 50 million days a year. So it's a huge loss to the economy. And also the NHS spends £1 billion sterling pounds on back pain management. So that's more than our health budget in Sri Lanka.
When we got into pain management, I also wanted, I know this is a very obvious question, but what is pain, Doctor?
Pain is, for the layman, pain is unusual sensation, unpleasant sensation, if I may be honest, unpleasant sensation felt by the brain from the various parts of the body which affects you physically and mentally.
All right.
All right.
So that's pain.
So to sum things up,
sense.
it's pretty much your body is not at ease, whereas usually every day you would consider your body to be at ease.
Yeah, I mean, when a mosquito bites you, you keep scratching your skin. So what you are doing is yourself, what happens there is you are stimulating your nerves repeatedly so that the pain pathway gets blocked at the spinal cord. So that's what we are doing. If you think, why do you scratch when a mosquito bites and why the pain disappears, you are repeatedly stimulating the nervous system and then it blocks the gate of the pain pathway.
All right, so obviously the causes of pain could be anything.
Yeah.
But now we're focusing on back pain today.
Yes.
What are the main causes of back pain in your experience?
I would like to divide this into a simple group. The first one is a simple group, then I'll go to the specific one later. The simple group is, it can be a musculoskeletal and ligamentous. A muscular is due to muscular sprains, and you can have aches and pains. I met few people actually throughout the last 2 days with aches and pains, maybe about 4-6 patients in personal friends' houses. And I think all those guys had pain in the muscles. Most of them were unfit, and including myself, and that causes pain, because if you're unfit, if you do something, you have pain, because the muscles are not used to. So that is one reason. And then the second one is ligamentous, where the spine, this is the spine.
Oh, yes.
Okay.
I was wondering why the spinal
I need
column.
to thank our consultant neurosurgeon, my good friend Mahesh Vijayaratna, for letting me have this.
Oh.
So I collected this from Kote.
Is this real though?
No. This was, I think, brought down from England.
Okay.
And she got me this spine. I had to collect at 12 midnight a few days ago from Kote. And so the ligamentous will be, there are ligaments around the spinal cord, over the vertebrae, and then they can sprain, and then that can lead to back pain as well. And the other thing is skeletal. Skeletal can be discs. These are the discs. Can I have a pen, please?
Definitely.
Yeah.
Here you go, doctor.
So these are the discs. Discs can prolapse, bulge, and touch the nerves and cause pain. Pain in the back and also pain running down the legs. And the other one can be a facet joint pain, which is called facet arthropathy. These are the facet joints. These are the facet joints. The facet joints, it's like a shock absorber. They keep the vertebrae together.
Okay.
So they are always moving. So that is also one of the commonest causes of back pain, facet arthropathy. Yeah. These are described in 1973 by somebody called Gormley. And it's very common in the young age group. And then there is sacroiliitis. This is the sacroiliac joint. That can give rise to pain. Back pain can be extending from neck to the bottom. That's the coccyx. Coccyx also can give rise to pain, especially at the coccygeal junction, sacrococcygeal junction. That's called coccydynia. So from there downwards to the coccyx, you can have pain, and that's back pain.
Right. So this is like the one you brought up with the young kids, about young adults getting a back pain.
Yeah.
Is there any cure for this?
It's like back pain. I don't think a doctor can cure back pain. It's a teamwork. It's doctors can help alleviate pain. But it's not a cure. Cure is like it's like diabetes. You can never cure diabetes if somebody has diabetes.
Yes.
You'll be a diabetic always. You might have your glucose, blood sugar under control, but you don't still call yourself a diabetic. Yeah, similar. So once you get back problems due to a lot of inflammation and arthritis, they never get back to normal.
Right.
But maybe a muscular sprain, ligamentous problem can get back to normal, but not a arthritis, inflammation, something like that. Okay. But then our job is to help cope with that pain.
So you usually would like prescribe them certain medicines?
Yeah, there are a lot of ways of treating. And also let me describe the second one. The cause of back pain is, one is trauma.
Okay.
Trauma is due to accident. You might have a whiplash rash. You might lift something from the floor, heavy stuff. You might sprain your back. You might dislocate your spine. You might prolapse your discs. Yeah, that is also a trauma. Second one is infection, like tuberculosis, multiple myeloma, things like that can cause infection is tuberculosis, and then cancers like multiple myeloma and things like that, or secondaries in the spine can cause back pain. Yeah, and also there's an idiopathic group. You can't find a reason, but they still have back pain. This group is normally called fibromyalgic, and is a loose term. In Latin, fibromyalgia means muscle pain, but they've introduced a nice term combining the Latin words and call it fibromyalgia. Myalgia, which is muscle
Muscle.
pain in layman's, you know,
Okay.
it's a normal terms.
I learned a new
Yeah.
word today.
Yeah, so,
But
yeah.
anyways, but I've actually looked into this recent documentary where they said everything is controlled with your mind. You could even cure the most, complicated disease if you just, think in a positive way.
Mind over matter.
Yeah.
but I don't think you can cure anything with your mind, but you can or you can live with that problem if you have a good mind.
Yeah.
Your psychological balance will be better, and you'll be able to cope with the problem. I don't think anybody can cure just by thinking about it or being strong.
But doctor, if you bring up, like, for example, if somebody gets cut,
Yeah,
isn't it your subconscious that controls whatever cells goes to repair that cut?
yeah.
Wouldn't it, if you could learn to control your subconscious, isn't it a possibility of us actually controlling
There
it?
is secondary effect, because when you are stressed, your inflammatory mediators increase, so the inflammation is more, therefore there is a slow healing process. But other than that, there is no truth in if you have a strong mind, it will cure quicker. But there is a secondary effect, as you said. I'm thinking this for the first time, as you wrote it. So the inflammatory mediators are less stress. Okay, you have if you have heart surgery, if you are strong and cool, relaxed, you have better chance of recovering quicker. But it won't make you it better than somebody else.
Of course.
Yeah, so
So at what point should a patient go to consult their doctor? Because back pain is something that is pretty common, isn't it? Every other person could have a back pain.
Yes.
And at what point does the pain get too much, or at what point do you recommend that someone should go and consult a doctor, because this is getting serious?
yeah, but in the UK we have a very good referral system which doesn't exist in Sri Lanka, unfortunately. In the UK we have tertiary, in the private, there are two systems. One is the sorry, can I have a glass of water, please, if you don't mind? Can somebody? Yeah,
Could we get a glass of water for the doctor, please?
yeah, please, yeah. So
We'll get the doctor.
yeah.
While we're getting the glass of water, please.
No, I'll keep, yeah. So in the NHS, I'll tell you the NHS. NHS, how it works is that the patients are referred by the GP to a booking system on the computer, and then the patient comes to a triaging center. So all the referrals come to one center, and that center decide where the patient should go. So there are neurosurgeons, orthopedic spinal surgeons, and also there are pain medicine consultants. Then there are other clinics which run complementary therapy, like we call it ICAT, Integral Clinical and Treatment Centers in UK. So a few consultants get together and decide triage. It's very important. Triaging is separating. So they triage where the patient should go. So normally first line is the pain medicine consultant. So we see them and we decide, okay, this guy doesn't need a surgery. Will we do interventions?
All right, doctor. So we'll go more into how you can treat these back ailments right after we get back from a very short break.
Okay.
Dr. Nama will be joining us every Monday to discuss different aches and pains that you can have in different parts of your body. So please be sure to join us for those segments as well. And now we're going to go in for a short break, but do stay tuned with us on Good Morning Sri Lanka.